The November 28th, 2017 meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Mrs. Brown?
Here.
Dr. Carbone? Here. Mrs. Conley?
Here.
Mrs. Draw?
Here.
Ms. Harris? Here. Mr. Hebert?
Here.
Mr. Lightfoot? Here. Mr. Moyo? Here. Chairwoman Taylor?
Here. Is there anyone signed up for the public forum?
Yes, there is. We have one speaker tonight. Would Tracy Taylor please come forward? You'll have 2 minutes in which to address the committee. Please conclude when the timer sounds. Thank you. Okay. Thank you. Good evening. My name is Tracy Taylor, and I'm a pediatric occupational therapist and supervisor at Step by Step Developmental Services in Henrietta, New York. I have been working in the field of early intervention for 24 years, 15 of which have been here in Monroe County. I have handouts for you to refer to later. In New York State, there has been not an increase, there has been no increase in the reimbursement rate for early intervention services since 2003. That's 14 years. In fact, the rate has actually decreased twice since 2003. How does this impact the children with delays in development or disabilities, which is our most vulnerable population? Agencies have left early intervention due to poor reimbursement. Providers, the therapists, have left early intervention for better paying jobs in different fields, such as schools and hospitals. We're not able to provide and attract new providers to the early intervention field, which is equaling provider shortages across the entire state of New York. And countywide, here in Monroe County, we have had year-long wait lists for over the last 2+ years. How can you help these most vulnerable children? The New York State Department of Health Bureau of Early Intervention is who sets the rates for early intervention reimbursement. I am asking that you work closely with your state legislators to address the following 2 asks. To please restore provider payments to the 2003 rates, and to also fund a comprehensive study of what the real program costs to provide early intervention services are. Thank you for your time.
Thank you. Is there anyone present who is not signed up to speak who would like to address the committee at this time? Being none, the next item on the agenda is the approval of minutes. You have the September 26, 2017 minutes before you. They will stand approved unless the clerk is notified of any changes by the end of the day. I would now like to introduce Robert Franklin, Chief Financial Officer of Monroe County, who is here to present the 2018 proposed Monroe County budget as it pertains to the Human Services Committee. We will have question and answer period following the presentation.
Thank you.
Thank you, Madam Chair. Ladies and gentlemen, just very quick overview of Monroe County's budget for 2018. Overall, Monroe County is looking at a $4.9 million increase in its total budget for 2018 compared to 2017. It's about a 1.3% increase, the majority of which is in our mandated services, which represents a $14.2 million increase over 2017 mandated services. Those areas more pertinent to the Health and Human Services Committee are our Department of Human Services, Public Health, our Community Hospital, and our Veterans Services Agency. looking just at our Department of Human Services, total appropriations are up just a little bit as total revenues decline, resulting in an overall increase in the county's support for the Department of Human Services, up to $262 million. Some of the larger divisions within DHS, financial assistance is the largest division in Human Services in terms of the size of the staff and the size of the overall budget. Just looking at some of the larger program areas, budgets are somewhat steady comparing 2017 amended and 2018 proposed. You'll see our family assistance and our safety net assistance budgeting declines going into 2018. Department of Human Services has had, in addition to just overall favorable local economic conditions, the Department of Financial, or Division of Financial Assistance, has been doing a pretty good job managing their caseloads and moving people from the welfare rolls to their highest level of self-sufficiency. And when we get into the nitty-gritty details, I'm sure there'll be questions on daycare. I'd like to highlight a perhaps proportionally small, but nonetheless an increase in our daycare appropriations specific to the Division of Financial Assistance. This would not include a preventive protective daycare. Also an increase, just over $1 million. Within our Child and Family Services, the second largest division within Human Services, again, looking at their proposed 2018 budget compared to 2018 amended, you see an increase in funding for overall division operations. We've discussed over the past several weeks and months increasing the number of casework staff within the Child and Family Services Division, adding 30 new caseworker positions. There's also been an increase in the caseworker civil service series, so the caseworkers, the seniors, the supervisors, to increase their pay group, one group, to provide better opportunities for the department in terms of retaining and recruiting new staff. At the same time, they've had favorable results in managing their adolescent care caseloads, specifically the JD and PINS populations, success in alternatives to detention and alternatives to incarceration. Child welfare focuses mostly on the foster care. Again, the division has done an outstanding job managing their foster care caseloads and bringing those down. And again, the daycare on this particular division is the preventive and protective related daycare. Those are the cases in which daycare could be offered as a means of assisting the family and preventing an imminent foster care placement. Just very briefly looking at our Department of Public Health, there is roughly a $5.2 million reduction. That is pretty much almost entirely related to grants showing up in the 2017 amended budget, which will not be reflected in the 2018 budget. Throughout 2018, the Department of Public Health will bring forward referrals for your review and approval that will amend the 18 budget to be more in line with what you see in the 2017 amendment. Oh, I'm sorry, one last comment. We usually talk about public assistance benefits in terms of Medicaid and welfare. We do have public assistance benefits within the Department of Public Health. Those primarily are the early intervention and preschool special education. In fact, public assistance benefits make up roughly 68%, or more than 2/3 of the total appropriations. Just looking at our community hospital, overall appropriations for the hospital are slightly higher than they were in 2017. I do want to mention a couple areas of change within the community hospital that you may be asking about when we get into the details. Similar to the casework civil service titles, there's a series of nursing positions. nursing supervisors, RNs, LPNs, and certified nursing assistants, their pay group is also being adjusted in the 2018 budget for the point of providing better job recruitment and retention opportunities. Oh, just to hit a few highlights within our community hospital. Big change for them this past year. They've implemented a new electronic medical record system. That system can interface with SAP, and that is significant for the hospital. This gives them opportunities going forward to better marry their resident demographic and care utilization data with financial data, and will assist hospital staff as they gear up for managed care rate negotiations. Also nice for the community hospital, a certificate of need has been approved for a new 20-bed ventilation unit and a 5-bed pediatric unit. And consistent with the past several years, I would point out there is no operating subsidy being budgeted from the general fund for 2018. Our Veteran Service Agency is one of our smallest departments in Monroe County, certainly not the least. Appropriations going into 2018, a little higher than their amended budget for 2017. 2017 budgets had been amended when this body accepted and approved the PFC Dwyer support grant. You'll see that reflected in 2018 as well. Madam Chair, I'd be happy to entertain questions when I return to the table.
Thank you, Mr. Franklin. Thank your staff for a good job. I will now open the floor to any committee members who have questions regarding the human services portion of the budget. Legislator Harris.
Good evening. I'd like to start off by saying thank you for the opportunity to make comment, and I'll start off with commenting on the press conference that related to the budget, the upcoming budget that County Executive D'Onofrio spoke on with her staff. Made a commitment at the press conference that she would invest $1.7 million more in preventative programming for children in 2018. And that was done before announcement made by Children's Agenda, and it was done before the actual budget meeting. So I'd like to know, where is that $1.7 million identified in this budget?
Madam Chair, that additional funding would show up in the Purchase of Services Fund Center. It can be found on page 195 of the budget book. Madam Chair, you're not going to see a number called 1.7 million on that particular page. I'll point out the amount of funding for purchase of services is actually higher than that, $4.1 million. Largely, in addition to funding contracts, vendor preventive contracts by the additional 1.7 million, there had been a supervised visitation contract with SPCC that had previously been budgeted in another fund center. That's been moved and increased and is now being reflected in the purchase of service section.
Through Madam Chair to the administration, can you tell me how much has it been increased?
Madam Chair, for this committee meeting, it's roughly an $800,000 increase, but we can follow up with a more precise number.
That would be to the administration through Madam Chair. That would be great if you can put that in writing. Going on to, I'm starting with Human Services, and thank you very much. Going on to Human Services, I have here on page 167, I'm looking at, and I was looking at the significant findings of the second Federal Child and Family Services Review that was done this year. What were the findings that you found? Because you have it listed as major accomplishments. Through the chair to the through Madam Chair, through the administration.
Through the chair, while we may not be able to share the entire document, it's fairly weighty. The highlights that we were specifically referencing included the 100% achievement of the 24-hour safety assessment, a significant increase in our matching of children to mental health services, and looking specifically at our foster care populations, the connections of youth and families to services. It's, again, a fairly significant document. If there were specific questions or items you were interested, I could certainly bring back additional information at a future date.
Through Madam Chair to the administration, is it possible if you can give us a summary of the highlights of that document?
I couldn't do that tonight, but I could bring that at a future time.
Absolutely. Through the Chair to the administration, we would love to have that in a report form. You can document that in writing. Thank you. To the administration, through Madam Chair, I also am looking at Human Services again, page 171. I have a question in regards to HEAP. I've noticed that it's being moved from the Financial Assistance Division, and I'm just curious as to why. I was looking at that, trying to understand that. If you could help me, I'd appreciate it.
Madam Chair, HEAP has been held out as its own division for quite a long time, probably more than decades. It had historically been a 100% funded program through New York State. I will say it has not been a 100% funded program for probably 12 or 14 years. The staff who work in the HEAP area also assist the Temporary Assistance Division in evaluating and approving applications for emergency heating assistance pursuant to a temporary assistance case. Since the staff in this area work on both temporary assistance related utility needs and seasonal utility needs, it just made sense for the Division of Financial Assistance to merge this into one functional area.
Thank you. Thank you very much. Going over to page 172, also looking at what they count as a drop in the Title XX DSS funding, and that drop is something that we've noticed from looking at the 2016 numbers. Can you explain why? What were the accounts? Why was there a drop in those in that particular funding?
Madam Chair, this is not a performance-based funding stream for Monroe County. Title 20 allocations have been declining. Title 20 originates from the federal government to New York State, and then the state allocates to the various social service districts. This funding allocation has been declining for over 10 years, and this is just one more year of a continual decline.
Thank you. Through Madam Chair to the administration, thank you for that. I'd also like to go over to page 172 and looking at the foster care block grant that's being reduced by $1.8 million. I could assume, based on your previous testimony in regards to grants, that will possibly be something that we'll be looking as a referral later. Can you clarify that for us?
Through the chair, the foster care block grant last year was the state rebased the entire appropriation in their budget, and therefore all the counties received lower allocations.
I lost part of your, through the chair to the administration, I lost part of your last sentence.
All counties in the state received lower allocations in the last fiscal year.
Thank you.
Legislator Lightfoot.
Thank you, Madam Chair. I have a question to you, to the administration. For some reason in my mind, and just correct me if you can give me some clarification, does the Department of Human Resources budget fall under the Human Service budget? Do you, Madam Chair?
It does not, Madam Chair.
So the budget is standalone. I don't know where I quite got that confusion. So through you, Madam Chair, to the administration, under the page 167 on the accomplishments that we have had for the Department of Human Resources, Human Services, we completed a study to transition the billing of preventive services to Medicaid health insurance. That bullet right there, the second bullet, there are several significant barriers to requiring preventive providers to bill insurance. Therefore, we will not be implementing. One, through you, Madam Chair, to the administration, can someone tell me, how much did we spend on the study, if we did at all, and more precisely, why? What are some of the barriers that are creating for us to be in this in this program, and what are the pros and cons? Maybe it's not beneficial in some way too. So I'm sure there's 2 or 3 answers that I'm looking for in that question, and I can restate the question if you need me to do so.
Madam Chair, this was actually at the time it was proposed, kind of an exciting endeavor from a financial perspective. It didn't really pan out. The theory was that within our preventive services realm, there are a number of services that, at least on the surface, it certainly appears that it's a Medicaid-related service and certainly billable within the Medicaid system. Barriers that arose, and by the way, Madam Chair, I believe the first part of the question was, what was the cost of this study? We can find the exact cost of the study. I will say it was under $20,000. We're not sure if it was under $10,000.
That's fine.
Okay, Madam Chair. The barriers that really arose are at the provider level. To become a Medicaid billable provider, in summary, the provider agencies, which normally provide social work services, need to establish themselves pretty much as a clinic. And the host of hoops they have to jump through are all healthcare related, such that they would have to hire and have on staff licensed psychologists or psychiatrists, clinical staff, and it really just became burdensome from a clinical perspective to make this worth the rates that Medicaid reimburses providers for their service.
Thank you. Thank you. Thank you. I think I recall some of that earlier in the year. Secondly, through you, Madam Chair, to the administration, the third bullet, Child and Family Services completed a second federal Child and Family Services review in 2017. In 2017 and 2018, we will focus on making strides in key areas identified and maintaining the strong performance found in others. Through you, Madam Chair, to the administration, what key areas were identified and that we are possibly working to make more strides on? Through you, Madam Chair, to the administration.
Through the chair, certainly as mentioned previously, I will submit a summary of the findings of the CFSR from 2017. In sum and substance, New York State is required to engage in performance improvement planning around the outcomes related to the CFSR. However, within that, Monroe County is performing well in several of the indicators relating to permanency and safety. Again, I will prepare a summary and submit that at a later date.
So, through you, Madam Chair, to the administration, what is your later date? What's your last end date? I mean, you know, I don't know what a later date is. I'm asking respectfully, will that be 2 weeks from now? I mean, where is the date?
I could certainly do it within 2 weeks.
Thank you, Madam Chair.
Legislator Moyer?
Madam Chairwoman, I'd like to stay on the same page, and I have a question under financial assistance, major accomplishments. It states in the final bullet point on the page that kiosks were applied for through the United States Department of Agriculture to assist individuals in processing their DHS paperwork and to check in for SNAP appointments. Do we know the status of that application through the chair?
Madam Chair, we actually did follow up on this recently, and as of now, the status is not approved.
Oh, well, that's too bad. I think it sounds like a good idea. I'm sorry, through the chair, is that a final decision to your understanding?
Through the chair, it's a final decision for this year, but every year we have an opportunity to apply for additional funding. So we will apply again next year.
Okay, thank you. And was the plan to have all those kiosks located at 691 St. Paul Street through the chair?
Through the chair, I think we were planning on putting those at Westfall Road because it's a little less congested there.
Okay. Through the chair, if I could give a possible place for another one, would be the Hall of Justice on the first floor, where people are going through landlord-tenant court and a lot of times are dealing with DHS in terms of financial assistance through there. So a good 60 to 70% of people are interfacing with DHS on a regular basis, so that might be a way to prevent an overflow into 691 or Westfall, just as an opportunity. Thank you, Madam Chair. I have another question moving on to page 196. I have a question regarding the major objectives under financial assistance. There's a project that was undertaken, or that we may undertake, which seems like to try and help people avoid sanctions. Am I reading bullet point number 1 correctly under financial assistance on page 196 correctly through the chair?
Can we check the page number, please?
169, I'm sorry. I said 196. I apologize.
And I'm sorry, Madam Chair.
The
Can you highlight the bullet?
The first bullet point under financial assistance.
Madam Chair, the Division of Financial Assistance Director could not be here tonight due to a medical emergency. We'd like to respond in writing before the legislative meeting.
Okay. I guess, well, I had a follow-up question that maybe I can just get out in the open and maybe it can be answered through the chair. I wondered if sanctioning people on DHS is mandated by the state.
It is, Madam Chair.
Thank you. Through the chair, in all circumstances that individuals in Monroe County are sanctioned by DHS, are all of those situations mandated by the state?
They are, Madam Chair.
Thank you. So just to ask the question again in a different way, so I have a concrete answer, I guess. It's not within the county's ability to relieve someone from sanction, it's all mandated by the state. Is that correct, through the chair? We don't have any wiggle room is what I'm asking for?
Madam Chair, the 18 NYCRR is pretty prescriptive in the imposition of sanctions. There's durational in the duration of those sanctions and the relief attempts. Anyone receiving a temporary assistance sanction does have an opportunity to appeal that through the fair hearing process. Turning a blind eye to the situations that would normally lead to a sanction could present a slippery slope and could put the department at risk in all future fair hearings. So it is a prescriptive process, but there is also an appeals process as well.
Okay, thank you. The basis of my question was whether the county had opted into sanction cases that were optional and not mandatory under the state. So I think that's been answered, and I appreciate that. I have another question related to something similar to that in human services under financial assistance. Has DHS contemplated interfacing with recipients either through smartphone app or through email to tell people what benefits have been dispersed for that month, whether something is due from them? Because I'll be honest, my experience tells me that the mail system in some parts of our area are imperfect, whether it's at the point of contact or in another place. And so contact through something more digital, but also more personally might be important to explore in the future. So I'm just asking if that's been contemplated through the chair.
Madam Chair, several automation or technological opportunities have presented themselves that the department has taken advantage of. The one that immediately comes to my mind is what we generally call robocalls. So SNAP, formerly food stamp appointments, recertification appointments. Those are all calls that go out directly to applicants and recipients. Although the mail process leaves much to be asked for, desired, there is an automated process for doing direct mailers to landlords when shelter allowances have been approved, discontinued, or changed. That has alleviated a number of problems that landlords have with the department. Certainly no smartphone apps have been deployed yet, but that's always in process. Oh, and I will say the New York State has funded significantly the child care time and attendance system, which would allow parents and providers to sign in and out their children at the facility electronically.
Okay. Thank you for that explanation. If I could, a text message system might work better. Current individuals seem to be using text messaging a lot more than voice phone calls, in my experience. Through the chair, thank you, Madam Chair. And for somebody to be notified that rent was reduced by $200 or $100 for their monthly allowance would be very helpful to some people rather than finding that out 2 months later when they're behind the 8 ball. So just something to think about, and I appreciate you hearing me out. Lachey, you can go back, John.
Legislator Lightfoot.
Madam Chair, thank you for recognizing me. I just want to go back to page 167. Unfortunately, Madam Chair, as I was explaining, none of my president is here. He was here before, but I'm just saying that I've downloaded I tried to work within the system, and I lost all my notes when I downloaded the budget after I saved it to this electronic device. And so you're in good shape, because I don't know what the heck I was talking about 4 days ago. However, I did print some pages, and I only had the highlights but not the notes, so I have to read through it. So, but thank you. Budget time is a wonderful time to ask all the wonderful questions and to better ourselves here at the county level. At one time, through you, Madam Chair, to the administration, we had a legislative meeting, and we talked about bullet number One, if I believe, on page 167 under financial assistance, I'm sorry. So the launch of Paths of Empowerment. And it appears to me that this program that we're providing, or this service, is to better support our people on financial assistance. One of the questions I would like to ask is, here it says here in the first 3 months of the program, several hundred former recipients have been offered assistance to address any issues that arise as they retain employment. So this initiative it progresses. I guess the question is this initiative, is there any additional cost to us to provide this initiative? Through you, Madam Chair.
Through the chair, there is $250,000 budgeted for a contract.
Okay, through you, Madam Chair. So this is a contracted services. It's not something that we're doing in-house. We're not doing it at the facility site or anything like that. At Westfall, I'm assuming, Westfall or nothing like that, yeah.
Through the chair, it's a service that's being done outside of our department.
Okay, thank you so much. I don't really have a whole lot on that, Madam Chair. One of the things that I do know in the legislative meeting, we talked about some of the programs and services, and someone spoke about being a good neighbor, and I was supposed to provide something over to Mr. Napier and family regarding the Good Neighbor pamphlet, and I have it, found one, and so I thought that somewhere in here, without getting tagged, I could say this in the budget. Okay, so I'll share this a little later.
Thank you.
As we go on to page 168, Madam Chair, to the administration, we talk about under the Youth Bureau, bullet number 3, that we reestablished. So we brought back the Explore Monroe program. Things we try in the past, we implement them, we do away, and then we bring them back. We have a rebirth. I guess through you, Madam Chair, to the administration, what I would like to know basically is, what is this Explore Monroe program costing us, and how are the benefits measured? Through you, Madam Chair.
Good evening. Thank you for the question through the chair. Explore Monroe is a program that is online and available to all youth and families, basically replacing the antiquated youth yellow pages and adult yellow pages that annually cost thousands of dollars to the taxpayers of Monroe County. This low-cost solution allows anyone with computer usage at a library, at home, or phone usage to, you can even download the app, take a look at what's going on in Monroe County. Our thoughts with it is to speak the language of the youth of today and let them know what great things are available in all the towns, the city of Rochester, everything in Monroe County, and let their parents know what's going on as well. It lists any events that are coming up, but also the resources that were listed in the old yellow pages. They're all updated, and the folks that are parts of those organizations can also update that information, post any events they'd like to go on. There's a great calendar option at the front on the home page, lets you see what's going on that day in the county. And anyone that wants to have their events posted there, we're glad to place those on there for them through the chair.
Thank you. So through the chair, you said that was an app or just a website?
I'm sorry?
Through the chair, is it an app or a website?
It is a website that is able to get on to through monroecounty.gov, and also when you Google Explore Monroe, it should pop up.
Thank you. No disrespect, not to cut you off. It was just, I understand. Thank you so much. It sounds like it's great that we got rid of the paper on that, but there still is a digital divide. Through you, Madam Chair, to the administration and to my colleagues. I know at one time we talked about free wireless internet across our areas. We know that we do provide them in some parts of the county, but we may want to revisit that, and you may see that legislation come across the desk after we could look for some partners on that, because the digital divide does happen. I see a lot of wonderful things. In fact, regarding this particular program, what would make it more advertising to youth is, and jazzy, is to make it an app, and download it as an app to their phones. And a lot of people, in my necessarily social economic level, may not be apt to want to Google Monroe County.
Well,
so, go ahead, sir.
I'm sorry. Through the chair, though, the digital divide that you mentioned, that app probably wouldn't help that. But also, if someone would like to have it printed, you're able to print it off the website at no cost to the county taxpayer. Also, we have been visiting perhaps having that app. That is a great idea. We're looking at that, and perhaps we can do that in the future. But also, having the digital device allows us to update all of that precious information, because I think you were trying to make mention to it. Let's say one of the resources is something as tragic as suicide prevention might be something that a youth is looking at, and if they are thinking of looking for help, they're going to type it into their electronic device, whether it be a computer or their phone, and search through a search engine, be it Google or something else, and say suicide help prevention. And Monroe County's Explore Monroe would be one of those options they could go to search for that. No youth is going to say, oh boy, where's that yellow pages that I received at a fair about 2 years ago giving me those resources listed. So that was kind of where we were coming from, through the chair.
I'm on your side, Madam Chair. Through you, Chair. I'm on your side. There's no worries here. We're on the same page, okay, on that. And your analogy, your example is exactly the way I was thinking when we start talking about mental health for our families and youth. So we're on the same page.
Through the chair, thank you.
Through this, to our next bullet, let's stay on there. Did we identify the cost it is to the county? I mean, it's just a website now, so we saved there. So the costs are kind of minimal. I was assuming that the update of websites are done internally. And are we tracking users? How is it being measured? Or is there any measurement tool at all?
Through the chair. Yes, through the chair. First of all, it was paid for when it was first created a few years ago through YDP funding, and we had to have it developed, and maintenance was taken care of. Glad to say here in 2018 that our Monroe County's IT force will be taking care of all the maintenance, and we'll be doing that in-house, saving us even more money now. And we're very happy about that. And as for updates and maintenance, and if someone wants to be a part of it, obviously we welcome that very, very much, and try to populate it as quickly as possible. So if someone were to look for it, obviously through one of the search engines, it would pop up. And also anyone that comes to the monroecounty.gov webpage would see it. But we've also gone school to school advertising it when we are able to do it. We were out this past summer at one of the schools here in the county, and they had a community garden at one of the high schools. The county executive was able to join us out there and have a press conference about it and release and say, hey, this is just one of the great events that are available on Explore Monroe. And so that word of mouth gets out there. Obviously, we would like to have an advertising budget for all of our programming, but we rely on word of mouth, Facebook posts, and our Twitter feeds, and getting it out that way. And rely on the media whenever they're able to get out there and cover one of our events. Through the chair.
Thank you so much. So through the chair, it'd be the one-stop portal, just one advertising piece could be there. But I still have not heard how are the benefits being measured, or if there are any measurements being analyzed. Or
through the chair, we monitor our increases based on those who register. They have to have an adult parent guardian to get on and register as a member of Explore Monroe. It also, like any other website, counts clicks and hits and folks that are searching it.
Okay, so through you, Madam Chair, and I'll move on to this. I'll move on to something else. Will you be providing us with something verbally or in written matter? How it's going. I mean, it's just not something to be on attack, but just for those who are interested in what our departments are doing.
Sure, excuse me, through the chair, we can get that information for you.
Thank you so much.
Legislator Monroe.
Thank you again, Madam Chairwoman. If I could ask a question regarding funding, it's on page 691. At the top of the page, under environmental health services, it appears that we've lost funding from the federal government. And my question through the chair is is that lead prevention funding, or is that something else?
Just trying to clarify, page 6091, federal aid.
Yes.
There is grant funding, and this particular federal aid was 100% grant funding. Just trying to clarify, is the question pertaining more towards the 2016 versus 17 amended, or the fact that there's zero budget for 2018? Madam Chair, the fact that there's zero budget for 2018 is grant related, and this body should see a referral in 2018 to amend this.
Thank you. Do we think it would be more in line with 2016 or 2017 through the chair?
Madam Chair, I believe, I don't want to answer that question at this table. We're going to have to follow up because I believe it's related to the lead program, but I'm not certain on that, so I want to follow up.
Okay. Thank you very much.
Legislator Lightfoot.
Thank you, Madam Chair. Like I say, it's a great opportunity to learn more about our organization. And on page 168, under the Office of Mental Health, the third bullet down, it tells us about our proactiveness in working with community stakeholders. It also tells us the initiative and advocacy for the court system in signing a 7 criminal procedural law, 730.40, final orders on felony charges. So it sounds like to me, Madam Chair, to our administration and the other parties interested, that it says here that we reduce the overall expenditure on forensic cost and on a case-by-case basis assess the best interest. This is one of our accomplishments for 2017. It also goes on to further say, through you, Madam Chair, to our administration and staff members, that we gave training how to best identify. And in the result of this, there has been an effort by the Rochester Psychiatric Center in implementing the Lean Six Sigma plan, a strategy used quite often to make organizations more lean, especially in the manufacturing business, to increase efficiencies and decrease lengths of stay. So when I read that, even though all the great efforts are best put to increase the safety of our community, reducing stay may not increase public safety, but potentially put people out faster who may not be necessarily ready to go. Do we anticipate, through you, Madam Chair, to the administration department regarding this matter, that there may be an increase of those with mental health problems out into our community, and are we do we project a need for increased budget, or have we increased the budget to prepare for that?
Through the chair, Dave Putney, Director of Mental Health. You've raised a lot of interesting points that could use probably quite a bit of conversation, but to your questions, we don't anticipate that this puts more folks out onto out of service or pushes them out earlier than they're prepared for. The counties across the state, including ours, have had an increased burden of share for the cost of individuals committed to forensic psychiatric hospital facilities. Those costs have risen from, in the early 2000s, from being 200 to maybe at most 400,000. And keep in mind, the split is 50-50. The state burdens 50% of the cost per diem, and the county carries the other 50% burden. Those had risen to 1.6, to 2.4, to 3.4, and we're projected to continue going on up from there. 3.4 million we're talking about here. So it's significant dollars. That's an unfunded mandate to localities based on state law. All of these efforts that you've read here, as well as others, have combined to lead towards stabilization, to not increase the growth rate of those costs. We would like to see it go significantly down. We're not at that point now. But in terms of individuals being forced to leave earlier, most of these folks would rather not be there if there were an alternative that were vibrant and leading to quality of life for them in the community. And that's what all of these initiatives and others do, to wrap around these people who deserve a chance in the community to lead productive quality of life pursuits.
Okay, so thank you for that explanation, and I will trust the administration's efforts in making our community safe regarding our mental health participants at this psychiatric. Thank you for all you've done.
Thank you very much. It's a pleasure. It's an honor. Thank you.
But it does lead me into another segue, Madam Chair, under our Monroe Community Hospital. And through you, Madam Chair, on page 2, as we go to page 228, we spoke about this in the beginning of our introductory, of our summary. I haven't quite put my finger on the question I wanted to ask initially, but I see one here that could buy me some time while I find that. So through you, Madam Chair, to the administration, on our page 228, the top bullet, one of the interesting points that you brought up was that there was that we are bringing on a 20-bed ventilator into our Monroe Community Hospital. However, this will satisfy the needs of the region. So do you, Madam Chair, to the administration in the form of a budget question, do we, are we bringing in people from outside our region? I mean, what have we been serving people outside the region, and will this increase costs as we serve more people outside the region?
Through the chair, Monroe Community Hospital does have a certain percentage of people who are non-Monroe County residents that we serve, but typically those persons do not increase our expenses. If we look at the ventilator and pediatric units as specialty units, which we have sought permission to create from the Department of Health and have recently received permission to do so, one of the primary reasons that we have gone in this direction was to enhance our revenues. And we estimate that once these units are in place, and fully operable, that it could increase our revenues by approximately $2 million a year.
Okay, great, wonderful. Thank you so much. Please remain there. One other question in this particular area through you, Madam Chair, to the administration. Under the 2018 major objectives on 227, the bullet there is telling us that we are partnering with other area providers, and I would like to know what, if any, are their costs of us coordinating and collaborating with other area providers, and if so, or if not, are we continuing to provide them? Because it says here later in the sentence that it's pending funding. So then I would like to know, what type of funding are we particularly anticipating, if possible, and is that funding divided among the partners that we collaborate, other stakeholders? I'd like to know more about how this impacts our financial budget.
We collaborate with other area providers through the Department of Health's DISRIP program, through the chair, which is the Delivery System Reform Incentive Payment Program that's referenced in the bullet that you've highlighted. This is a collaborative effort which does not create any additional expense to Monroe Community Hospital other than the time commitment that some of our staff puts in to attend meetings. And there are a number of different clinically programmatic areas that DISRIP addresses, not all of which pertain to the hospital. But one of the areas that we have explored as participating in our region is behavioral health. We would anticipate receiving a small grant to pursue that particular arena. We have up until now met all of the criteria to receive the grant, and as I best recollect, it's about $65,000.
Thank you. I'm satisfied with that very much.
Yes, are you done?
I am for this line of questioning. I will have more before you move on and
Okay.
come back.
Legislator Khan.
Thank you, Madam Chair. I wanted to take a minute to thank the county executive and her staff for this budget. I think it increases preventive dollars, it increases daycare dollars, it increases money for 30 new caseworkers, it leaves the senior caseworkers and the supervising caseworkers at the same level, which means we're putting boots on the ground, investigators in people's houses, doing work, assessing safety. I'm really grateful for the addition of the funding to this budget, and I wanted to compliment the county executive and her staff for doing so. It's going to keep our kids home, it's going to keep kids safer, and it's going to benefit our entire community because strong families keep our community safe. So I wanted to thank you for that. With that, I have a couple of questions, as you can imagine. I wanted to start with the Child and Family Services budget. I know that you had referenced the federal report that was mentioned on page 167, and I was wondering if you could tell us approximately how long is that report? Is it several hundred pages, or?
Through the chair, the report itself, we will follow up with the legal department as to whether or not it is our document or the state's document. as far as the number of pages, it's not several hundred. It's a fairly weighty document, though.
Okay, thank you. I was wondering, I know that in the objectives through the chair, it says that there was 100% achievement of 24-hour safety assessment, and I was wondering if you could explain to me what that means.
Through the chair, sure. Child protective investigations require that when an allegation of maltreatment is received, the county is required to engage in an immediate safety assessment, immediate being within 24 hours. On the sample of cases that was pulled for this audit, Monroe County did achieve 100% compliance.
Thank you. And through the chair to the administration, am I correct in that the administration or the county doesn't actually choose the cases that are pulled? They're chosen by someone who has no idea which cases they're choosing. Is that right? Is it the federal government that chose those cases for the audit, or is it a state representative?
Through the chair, the overall CFSR measures are federal measures. However, this audit was completed by New York State. Therefore, OCFS identified which cases would be selected.
Thank you. There was, through the chair, there was a discussion about increasing matching mental health services for children as an objective for 2018, and I was wondering if you could tell me a little bit about what you mean by that.
Through the chair, can you give me something more specific? I'm sorry.
Yep, it's on page 167, I think.
Through the chair, on page 167, I'm not seeing a reference to matching mental health services.
I took bad notes. I'll come back to that. I apologize. I wanted to ask also about the Center for Youth funding. I know that the Center for Youth for the last 5 years has received grants from the state to fund the Safe Harbor program. And I know that in many years, the Safe Harbor program has assisted children who are being sexually trafficked to connect with the FBI to help prosecute the pimps and to keep them safe and to get them services. And I see that the state is decreasing their award to us, to Monroe County. And I was wondering if you had statistics on how many children had been served by the Center for Youth Safe Harbor program in the last 5 years of the grant, and specifically how many were served last year in 2016.
Thank you. Through the chair, I know I'll sound like a broken record with some of the Safe Harbor stats from the last time that we were here, but that's the job. So there stats for this year through this end of September, just to answer that question through the chair, 234 youth have been referred through this program, through Center for Youth and through the county, 234 cases. And again, that's just through the end of September. 2016, there were 266 referrals. 2015, we had 209 referrals. 2014, we had 127 referrals. And in the very first year that we were going, we had 62 referrals. And to think that in New York State alone, I believe that there were 36 or 37 referrals statewide before Safe Harbor came into existence. It's a shocking number. And I know you have a passion for this, legislator, so I'm sure that those numbers aren't a surprise to you. Through the chair, though, the $25,000 I know looks like a decrease, but if you'll recall, when we first received this grant, we went through the International Office for Adolescents. IOFA is the shortened version, and we had to go through them to receive this grant through New York State. They are OCFS dollars, but we had to work with IOFA to receive this grant. We also thought it was a great opportunity to partner with the Center for Youth, who quite frankly is the only show in town that could perform this for us. We received the grant for 5 years, and it was a 5-year grant. They told us that, at the end of this, you're probably not going to receive further funding. But through the success of this program and through the hard work of the folks at Center for Youth and the folks here in Monroe County, they gave us what was called a graduate community status, which allowed us to receive $25,000 we weren't scheduled to receive for 2018. It's definitely a decrease from the previous 5 years, but that they have recognized Monroe County and the Center for Youth for the excellence that we brought to this program is nothing to slouch at. Through the chair.
Thank you, Mr. Berry. And through the chair, I was wondering if the children who had been identified in 2017, if they will continue to receive services through Safe Harbor if this money runs out.
They will still receive the services. It's going out from this point forward that we're worried about. We've identified all of these youth through the past 5 years, and you can see that that number is steadily increasing. Well, those youth, those victims will not be found because we will not receive that funding. Center for Youth, we just can't pay them to do that. And they did receive, through the chair, they added on to their fundraising efforts to make up for the difference that they lost for the 2017 funding.
Thank you, Mr. Berry. Through the chair, one of the objectives in the Youth Bureau budget says for 2018 is to evaluate the validity and importance in runaway and homeless youth programs. And I was wondering, how would that evaluation occur? Is there some thought that it's no longer valid to accept the federal RHY funding?
To receive through the chair, to receive the state funding through OCFS, as you know, that they allocate hundreds of thousands of dollars to runaway homeless youth programming. The objective to evaluate the validity is merely to make sure that that population is being served correctly. The evaluations that are done are quarterly reports and annual reports by the folks that perform these services for us, contracted services for us, that being the Salvation Army / Genesis House and the Center for Youth. Their numbers are not decreasing, and their programs remain at or close to capacity. So I don't forecast a reason that we would stop receiving these dollars.
Thank you. That's reassuring to me. Through the chair, last year we contracted with the North American Family Institute for over $1 million for foster care services. And I was wondering if we're going to continue to contract with North American Family Institute this year. And because I had heard through the grapevine that we were not going to continue that contract.
Through the chair, North American Family Institute was providing therapeutic foster care services in Monroe County. They did struggle to recruit and retain foster homes for the population. They additionally struggled to maintain the required staffing for program director clinical positions. And just recently, they have made the decision that they are not able to adequately staff, essentially, the program that they want to provide in Monroe County in our community. So they are in the process of ending services in Monroe County for 2017. We have planned with Hillside, which is where our other TFC homes are located, to absorb any foster homes that want to continue to provide therapeutic foster care services. And if families have chosen not to continue that level of care, Monroe County is also going to work to absorb any homes that are interested in just maintaining a regular foster care level of need status, and will continue to provide those services in our county through the chair.
Thank you. Through the chair to the administration, do you have an idea of how many disruptions this may mean for children in foster care? Are there rough numbers?
NAFI, or through the chair, North American Family Institute, or NAFI as they were known, had achieved certification of, I believe, 8 homes. Mm-hmm. 5 of those homes are going to be absorbed by Hillside, so those youth will not be disrupted. 3 of the homes are moving to Monroe County. Okay. And again, we'll certainly try to keep those children in those homes. Those children, however, were placed at that level of care because of their own particular emotional behavioral health needs. Sure. So we'll do the best that we can.
Thank you. Through the chair, on page 176 of the budget, it appears that there's an expected decrease in adoption finalizations for 2018, and I was wondering if you could tell me why.
Through the chair. Sure. In 2014 and 2015, we had a higher than usual number of TPR petitions filed, which resulted in a higher than usual number of adoptions. For later 2015, 2016, the number of TPR petitions filed is more in line to the average number, and therefore the number of adoptions finalized has decreased.
Thank you. Through the chair, it appears that there's, on page 191, an anticipated decrease of approximately $2 million allocated for PINs and juvenile delinquency residential care. And I was wondering if you could tell me why we anticipate such a substantial decrease.
Through the chair, I'd have to say this is a little bit of a mystery. We've spent a great deal of time in our Juvenile Detention Alternatives Initiative Collaborative, which includes several of our Monroe County Family Court judges, as well as residential community leaders, the police department, probation, and a variety of other leaders related to child welfare. We continue to see the number of PINS and JD placements decline. We do provide a variety of alternatives to detention, and we've spent a great deal of time, specifically in 2017, focusing on the quality of services provided by those ATDs. We are correlating that work to the decrease, to some extent, of the PINS and JDs, but we've struggled to find a direct correlation to one particular intervention.
Thank you. Through the chair to the administration, you could have just said it's because I'm doing such a good job in family court. Through the chair to the administration, for child preventive services, page 195, I'm pleased to see that we're really increasing funding for the preventive services, and I was wondering, are there new agencies that are going to be contracting with the county to provide preventive services, or are we offering more robust services through the existing contracting agencies? And as a follow-up, can I get a list of the contracting agencies that are offering preventive services?
Through the chair, Monroe County did an expression of interest for preventive services in 2016. We are not adding programs at this time. What we are looking to do is increase the number of slots in the preventive programs that have high utilization and directly correlate with the needs that we're seeing in our populations. And so what we've done is added to the budgets for those preventive services, which are a combination of evidence-based, evidence-informed, and outcome-based contracts.
Thank you. So through the chair, would I be able to have a copy of the list of preventive services agencies?
Through the chair, sure.
Thank you. Through the chair, on page 219, the discussion of new caseworkers. As I said earlier, I'm really pleased that we're going to have new caseworkers doing investigations. Do we expect there to be more petitions filed in family court as a result of increased investigative workers?
Through the chair, I don't think you can make that correlation. If you look at staffing patterns over the last 10 years, we are returning to a staffing pattern that we had during the time of Project SAVE. And that, at that time, did not result in an increase in the number of petitions filed. I think ultimately whether or not petitions are filed and whether or not that increases will depend solely upon the types of investigations that we're receiving and whether or not there is a determination that there is a preponderance of the evidence and the need for family court intervention.
Thank you. Through the chair, I have some questions about the Department of Health budget. There are, on page 300, there's some information about early intervention evaluations being completed within a 45-day period. And I see that it's anticipated that there would be a decrease in completed early intervention evaluations. So my first question is there a consequence to the county for failing to meet a particular benchmark in terms of completing the evaluations within 45 days?
One moment, Madam Chair. The program director is on her way.
Thank you.
Our apologies, Madam Chair. We'd like to follow up on that with that question in writing. The EI program manager is not available.
I can certainly submit it in writing. I'm curious about the Monroe County Hospital 5-bed pediatric unit that's anticipated to open. I was wondering if you could tell me what are the types of cases that would be appropriate for a pediatric stay at Monroe Community Hospital?
Through the chair, we anticipate primarily two types of pediatric patients that could feasibly be admitted to the unit. One would be pediatric cases who are also on ventilators, and the other would most probably be pediatric children with traumatic brain injury that require extensive rehabilitation.
Thank you. Through the chair, are there children currently in the community that have traumatic brain injuries that are at home that would be more appropriate in a county hospital setting?
There are potentially children in the community who are unable to be placed at home. Those who are able to be placed at home usually and typically are, but there are those who are unable to be placed at home, and currently those children are being referred to facilities as far away as Albany.
Thank you. Through the chair, so we're not specifically talking about children who are currently or in the past would have been placed with Sister Jean, the specialized foster parent that works with kids that have...
Through the chair, that's correct. These children would be much more medically complex.
I see. Okay, thank you.
Yes, Legislator Harris.
Through the chair to the administration, I'd like to take us back to the bullet point where we had Legislator Conley had brought up about the youth. To be clear, the youth homeless. Actually, I pretty much lost my spot here, so bear with me while I grab where I was at first. Trying to get used to the technology here. Under major objectives for 2018, I just want a follow-up question in regards to the runaway homeless program. You mentioned something about there's various beds for homeless youth available around the county, and I'd like to know, do you have a counting of how many beds are available in this county for homeless youth?
We can get you those, through the chair, we can get you those numbers for the next meeting. Again, we deal with the Center for Youth, and the Salvation Army Genesis House is our contracted service providers for runaway homeless youth, and we'll reach out to them to ensure we get the correct number of beds.
Thank you. And if you could please, through the chair to the administration, could you please clarify if these beds are exclusively for children, or are they available to adults too?
Through the chair, I can answer that question. They are not generally used for adults. We contract with Center for Youth and Salvation Army Genesis House for certain age levels. If you recall, Hillside used to perform these services. They no longer do that, hence the reason that we are at these two service providers. And between the two of them, there are certain age groups that they will take. Center for Youth takes one set of ages, and Salvation Army Genesis House takes the other set.
Thank you very much. Through Madam Chair to the administration, I just was curious to know if when these children are processed for this, for these beds, what kind of considerations are they assisted with? Are they paired up with social services to assist them with things like benefits, or just continuing on with school, those types of things? Is that something you guys have an accounting of?
Through the chair, through our service providers, they're providing beds for these youth. There are also YDP dollars that are used by Center for Youth to provide certain services. I think you're lumping in everything into one service provider, which neither one provides.
Thank you for that clarity. Through Madam Chair, to the administration, I'd like to go and ask a question about human services on page 180. And I just need a little clarity as to what is the engagement rate under employment referring to on page 80. I'm just a little confused by that. To the administration, through Madam Chair.
Madam Chair, just to clarify, we're talking about the definition or the derivation for what is engagement rate under the employment statistics?
Yes. I'm just curious as to what that's referring to, if you could clarify for me.
Madam Chair, the engagement rate in employment services is the number of temporary assistance recipients engaged in a work activity divided by the number of temporary assistance recipients who are not otherwise exempt from being engaged in a work activity.
Okay. Thank you for clarifying that. I believe that would conclude my questioning. I want to say thank you so much for all the hard work that's been put into this. I'm really happy to see that you are able to provide the answers to those questions, and look forward to the answers for the other ones I have in writing.
Yes, Legislator Hebert.
Madam Chair, through you to the administration, on page 174, there's an increase in the budget, and on page 515, there's an increase in salaries. I believe you answered one of these earlier, but do these two line items specifically account for the 32 CPS caseworkers positions in the 8-point plan?
Madam Chair, just to clarify, we're on page 174, and the two lines, again, are personnel, and I missed the second one.
In page 515, through the chair.
It's 515, Child and Family Services. Yes, Madam Chair, both of these pages correlate and would identify the funding associated with the new positions.
Thank you. Again, through you, Madam Chair, once again, on page 515, under professional services, what services account for the increase of over $400,000?
Madam Chair, at least $200,000 of that increase is for the new contract with the agency formerly known as Ad Council. Oh. I spoke too soon, Madam Chair. The intent is to spend $200,000 on an agency that can assist the department with recruitment efforts and retention efforts, but that service will be RFP'd out. Madam Chair, there's also another $200,000 in this particular line item for a Families First campaign, and then a nominal amount of money for caseworker safety program and a kids group.
Through you, Madam Chair, just as clarification, so this is related to the 8-point CPS caseworkers programs, correct?
It is, Madam Chair.
Thank you. One last question. Once again, on page 515, under computer equipment, there is a $0 to $72,000 increase. Is that to provide the tablets for the 30 new CPS caseworkers as well as the existing caseworkers?
Most of that, Madam Chair, is the tablets for the existing and new caseworkers. There is also a small amount of money within this line item for training room equipment.
Thank you, Madam Chair. That's all I have.
Legislator Conley?
Thank you, Madam Chair. Through you to the administration, will the tablets have access to connections?
That is the intent, Madam Chair.
Thank you. So the caseworkers will be able to document things contemporaneously with observing them in the field? Through the chair?
That is the potential opportunity, Madam Chair.
Thank you, Madam Chair. That is fantastic. Excellent.
Legislator Lightfoot?
Page 169, through you, Madam Chair, to the administration. To thumb through, I just have a few more questions, and I'll be all set. Here are the, as we talk about the CPS, the CF, the Child and Family Services, work with Causewave to identify a strategy focused on caseworker recruitment and retention, and work to implement the strategy, which we don't know. So, will this strategy that we hope for them to bring to us, will it be something that is evidence-based or not? And the reason I ask that is related to a budget question, assuming that evidence-based programs costs more. So basically what I'm asking really is, what is the impact of Causewave on our budget to implement this caseworker recruitment strategy, and some consultant work on how to retain? Through you, Madam Chair, to the administration, please.
Through the chair, the strategy work that was done through a small contract with Causewave was focused on assisting Monroe County in identifying what the factors were that could positively impact our ability to effectively recruit high-quality staff, particularly where we should focus our recruitment efforts to ensure that we had a higher success rate bringing in people who are well suited to the work. This is not a preventive service. It's not an evidence-based intervention. It was a research effort, essentially, to help us create the structure for the RFP that we will ultimately be putting forth early this year to support our efforts at recruitment and retention of caseworkers.
So, but it's mentioned as an objective, so it made me think that we hadn't used their services yet. But as I hear you say, we have used their services so far, and that they have done some consulting work and telling us some factors, some variables that may have an effect, whether those effects are significant or not.
Through the chair, the use of Causewave was to identify the strategy.
So we identified a strategy through Causewave. So, but like I say, it's down here as an objective for 2018. And so, but it sounds like we already done it.
Through the chair, the strategy is down for 2018 because the completion of the strategy will be put forth in an RFP that we will use to move forward the strategy in 2018.
So we think to believe, through you, Madam Chair, that the strategy that they have put together will have a significant effect, that we'll have a retention. So, if they provided, through you, Madam Chair, if they provided a service and we're going to use their analysis to put out our RFP in 2008 as our next objective, do we believe that the retention that we're going to have for the people that we hire will be significant?
Through the chair, the goal is to put forth a strategy that elicits a response from a variety of vendors who will then be in a position to implement that strategy and do exactly what you're talking about, to ensure that the folks that we recruit to act in child protective services are the highest quality and that we retain a high number of those staff.
So am I hearing that Causewave, through you, Madam Chair, is not necessarily going to be on the vendors that's going to implement the strategy to hire caseworkers and retain them?
Through the chair, I'm sorry, were you finished?
Yeah, through the
Okay,
chair.
I'm sorry, through the chair, I didn't mean to interrupt. I don't know who will respond to the RFP.
So I guess through you, Madam Chair, I'm asking, how is cost wave in this 2018 objective? I'm still not understanding clearly exactly what cost wave is doing. I think I understand that cost wave have done some investigation and research on some variables and strategies that will help recruit and retain caseworkers. But I'm also hearing that the results that they found, we will put into a RFP to solicit someone else to provide the services that will solicit and hire and work to retain caseworkers. Through you, Madam Chair. Am I hearing that correctly?
Madam Chair, the legislator is understanding correctly. During 2017, the department did work with Causewave on a small contract to assist the department in developing a strategy that can be implemented to improve their job recruitment and retention. The strategy developed by that small contract with Causewave will be implemented in 2018. However, the department needs to issue an RFP for that service due to the financial size of the contract. Madam Chair, perhaps it was a little presumptive, perhaps inappropriate for us to include the objective naming Causewave, since we don't know who will actually respond to the RFP.
Thank you, Madam. Thank you. So, do we know roughly what this budget impact will have on us?
Madam Chair, the department has requested an appropriation of $200,000 for this implementation.
Thank you. Madam Chair, through you to the administration, I'll move on to another bullet under the office. On the same page, under the office for the aging, the second bullet, introducing the Aging Mastery Program for our area senior centers. I would like to know if you could just briefly tell me what that program is going to entail and how it will cost or affect our budget. Through you, Madam Chair.
Through the chair. The Aging Mastery pilot that we did was very successful. We had 100% satisfaction and 100% graduation from participants. We plan to utilize our Title IIIB and CSE and CSI dollars to try to continue the Aging Mastery program, expanding it into 8 additional sites where we have sub-license opportunities, and then working within those organizations to identify sustainability plans so that they can continue to offer the services to the community.
So I heard you say, through you, Madam Chair, two funding streams. Gave me some acronyms, which I don't know, and I don't necessarily need to know. But so will it have an effect on our budget, or will this be grant monies?
My apologies. Through the chair, those funding streams are our federal and state funding streams, and it's already built into the programming for next year for senior center related rec and ed.
Thank you. Through you, Madam Chair, on page 189, I have a question for the administration. I just wanted some clarity. In the division description, on the last sentence of the second paragraph, it tells us that these costs are 100% reimbursed through a combination of federal and state funds. So I may have misspoke where it is, but that's where it is, second to last. However, I see here that our net county support is, as you can see, roughly almost 175 million. So I'm a little slightly confused, and I'm looking for clarification through you, Madam Chair, to the administration.
Madam Chair, no doubt our writing ability could stand some improvement. The gist of what we're saying here is Monroe County is responsible for remitting to New York State reimbursement for Medicaid, and that reimbursement is equal to our statutory Medicaid cap. In addition, there are some other Medicaid costs that the Department of Human Services pays directly. They write the check for the service. Those Medicaid services includes purchasing third-party health insurance on behalf of a Medicaid-eligible beneficiary, perhaps some personal care services or transportation services. Those direct payments made by the department are reimbursed by New York State and the federal government 100%.
Okay. So, through you, Madam Chair, as if I heard correctly, and so you told me the number is fine. I trust you on that. So, but the third, you told me that the third party payments are what we're being reimbursed for. Do I understand that correctly through you, Chair? And I kind of missed the first part. I'm sorry.
So, Madam Chair, when, in addition to our statutory Medicaid cap payment that we make, we do pay other direct costs like
Right.
third-party health insurance. And New York State will reimburse the department 100% for those expenses. The added flavor, however, Madam Chair, is refunds and repayments of prior assistance payments made. Those repayments and refunds collected by the department are treated like a state reimbursement. So if we spend $1 on third-party health insurance, before New York State reimburses us, they first ask us how much we got in refunds and repayments. If we got $1, they don't need to send us anything.
Right. So this number, all right, thank you. I'm still not understanding that 100%, but there's another year. Another year. And we'll get better understanding on this a little more. But we do know that it does tell us that we're 100% reimbursed, and then it states another number. So there is some confusion there.
And
so,
Madam Chair, just for very added clarity, the bottom line net county support required is equal to our statutory Medicaid cap payment.
But this right here is through you, Madam Chair. Is this 175 estimated our statutory number? Or?
It is, Madam Chair.
Okay, that's what. Okay. And we're coming to an end for me. I think just two more. On page 190. In the division description, this last paragraph tells us about daycare. This project will provide a daycare subsidy. Oh, okay, yeah. So again, I'm assuming through you, Madam Chair, and to my colleagues in administration, I'm thinking that when I heard the executive talk about a training program that we're going to be implementing, I think that, and I'd like for you to get some clarity on me, because there still isn't any numbers, estimated numbers to this, of people that would be children served. However, I'm sure it is an item that has been budgeted, that we will be providing daycare. And I may be off on this, but in the short of reading this, we're going to be providing some type of daycare services for those who are enrolled in the facilitated enrollment grant or something. Through you, Madam Chair?
Yes, Madam Chair, and I would point out that in the division description, we do have an estimate for the monthly average number of subsidy payments to be made.
Oh, yeah.
7,432.
Mm-hmm. Mm-hmm. So, through you, Madam Chair, is this just the basic subsidy daycare program that we have, or because in this last paragraph it's talking about those, and I'll get more specific with it. I apologize. It's going to be provided for low-income individuals enrolled in an approved training program. Okay, when the trainee is not receiving public assistance, so they're in a training program, but they're not getting social service, or is eligible for eligible daycare. So they don't qualify for daycare. They do not get public assistance. So to me, it makes me think that they're working.
So, Madam Chair, once again, perhaps our writing skills could stand some improvement. On this page, the daycare services provided reflect daycare services for families on temporary assistance who are authorized daycare services so that they may the parent may participate in a work activity or other activity mandated for their continuing eligibility.
Like educational and stuff, school and stuff?
Yes, Madam Chair, it could be a work activity, an educational activity, a drug or alcohol treatment activity. This page also accounts for the low-income subsidy daycare program. The low-income daycare program would be working parents who just don't earn enough that they qualify for a government subsidy for the services received. This page also accounts for the daycare provided pursuant to the facilitated enrollment program. Eligibility standards for the facilitated enrollment program are a little higher than the low-income program. Low-income program statutorily serves up to 200% of the federal poverty level, whereas the facilitated enrollment serves up to 275% of the federal poverty level. I will point out, Madam Chair, that while the payments flow through the Department of Human Services, facilitated enrollment eligibility is managed by WDI, the Workforce Development Institute. This page also includes daycare services that will be provided pursuant to URI funding, the Upstate Revitalization Initiative. Monroe County DHS received roughly a $3 million grant over a 3-year period.
Okay, so thank you to you, Madam Chair, to the administration. You know, a lot of this is written on those who are knowledgeable, and us novice here are wondering what the heck's going on sometimes. So thank you so much for being polite on that. Finally, is just a question on page. Oh, please take me away there. 288. It's really under the medical examiners, and it's not really a question in specific. It's just a question in budgeting matters. You know, and one of the questions is, you know, has this department audited at any time for efficiencies and cost effectiveness, internally or externally? Through you, Madam Chair.
Interesting you ask about that. Madam Chair, the department as a whole has to file a number of institutional cost reports with New York State DOH. Those are audited, so from a financial perspective, the cost should be good. Since the legislator is asking about page 288, which is a description of fees and charges, Department of Finance, and specifically our internal audit unit, is interested in working with staff of public health and the medical examiner's office to validate the level of fees for appropriateness and as they pertain to contracts with out-of-counties. We provided a similar service with the Department of Public Safety and their crime lab contracts, and the fees are charged. And we would like the opportunity and are making plans in 2018 to validate these fees.
And so, finally, thank you. Who do we sign? Who do I don't know who do we charge these fees to? I mean, we charge them to the people that's doing the funeral homes, or other counties, or what? These are all through you, Madam Chair, to the
Madam Chair, there's a variety.
Okay.
Certainly, other counties, we have contracts with
Okay.
other counties who send us their cases.
No worries.
Okay.
No worries.
Thank
It's
you.
not- I'm out. Thank you so much.
Legislator Moyer?
Thank you again, Madam Chairwoman. I have a number of questions under the public health heading. So, looking at page 278, am I correct to assume that vital records will be moving to something called the Ames Building? Through
Yes,
the chair?
Madam Chair.
Well, forgive my ignorance, but through the chair, where's the Ames Building, and is it owned by the County of Monroe?
Sorry, Madam Chair. Yes, the Ames Building is owned by the County of Monroe. It's over on East Henrietta Road, kind of near MCC.
Okay, thank you. And it's just moving into otherwise available space through the chair?
Yes, Madam Chair. Actually, the medical examiner's office is over there right now, so Department of Health does have a presence there.
Okay, thank you. I'm looking at page 279, and it appears that appropriations are dropping by $5.2 million. Can an explanation be provided for that through the chair?
Madam Chair, overwhelmingly, that relates to over $5.3 million of grants reflected in the amended budget for 2017.
Okay, thank you. I expected that answer. And do we expect those grants to come through again as they did in 2017 throughout the year through the chair?
Madam Chair, those grants have been received for quite a long time, and I would expect the same.
Thank you very much for those answers. Page 290, regarding the forensic laboratory, is there a current backlog for drug and other types of analyses that are done there through the chair?
Through the chair, there is always a backlog. We've seen it expand in the recent year due to increasing caseload.
Okay, thank you. And is there any sort of a plan or projection to bring that more in line with the past in terms of a backlog through the chair?
Well, through the chair, in the 2018 budget, there is provision for 2 new toxicologist positions.
Okay, thank you. And just from my edification through the chair, what is the current backlog if something was given to the lab today? When would we expect that to be processed?
Through the chair, it'll vary based on the nature of the case. Some of them only require alcohol testing, and those can be turned around rather rapidly, whereas cases that have extensive drug testing necessary have to go through several phases of screening and then follow-up testing based on what we find.
Okay. Those are all my questions right now. Thank you.
Legislator Harris?
Forgive me, I have one more question. I was perusing through, and I found one that I lost earlier. I'm just looking at the 2018 major objectives. Through Madam Chair to the administration, I'm looking at financial assistance, the second bullet where it says trauma-informed practices. And I'm just curious to know what would be the county's results of the 2017 implementation of that? And can you go into details of what that program is about? Through the chair to the administration.
Can we ask for a page reference, please?
I apologize. That would be page 169.
Through the chair, in 2017, Monroe County did receive a small grant from the Wilson Foundation, along with several other agencies in Monroe County. Specifically, Monroe County utilized those funds to ensure that all of our staff in Child and Family Services and in financial assistance had received basic training regarding what trauma is, what the impact of trauma is on the families that we serve. We additionally used those funds to begin looking at how the way our staff engages with our clients and families can impact the service that we provide. Through the chair.
Thank you. I'm very interested, through the chair, because this sounds very interesting. Through Madam Chair to the administration, I'm just curious to know, I see that you are planning to, based on what's written here, to do more for the folks that we serve through the county, through the chair to the administration.
Through the chair, I think I'm needing a little bit more clarification on your question.
Through Madam Chair to the administration, it says here in 2018, DHS exploring these issues and taking steps to consider the impact on trauma in both the people we serve and our staff will be continued. So I'm just looking at that. What kind of opportunities are you looking at for the people that we serve? I'm sorry about the misclarification.
Through the chair, thank you for the clarification. Monroe County is continuing to ensure that all of our staff, including those new staff coming in, will receive the basic trauma-informed education to ensure that all of our clientele is treated with an understanding of how their life experiences might impact their interactions with our services. Additionally, specifically in Child and Family Services, recognizing that the work that is done by our casework staff often results in secondary traumatic stress, which can impact our turnover. So additionally, we are focused on creating a wellness, trauma-informed focus for our staff to ensure that the leadership and the supervisory support that they receive is mindful of the impact that the work has on their trauma response.
Thank you. Just one follow-up question is just through the Madam Chair to the administration, we are expecting that grant to continue in 2018?
Through the chair, we did apply for that grant. We have not yet heard whether or not we received it.
All right, thank you.
Mr. Hebert?
Thank you, ma'am. Through the chair, this is the Service Agency. On page 352, PFC Dwyer program, you list two new objectives, one of which is a dog therapy program. Could someone just talk a little bit about how that will be implemented and what it will cost?
Through the chair, working with the dogs in the PFC Dwyer grant, that's something that we've spoken about, but we haven't yet started the process of planning that out, working with PFC Dwyer, and the appropriate money that's going to be taken from that grant and how we're going to fund that. So it's still in development. Through the chair.
Thank you. Through the chair again, could you just give a little explanation on what the expansion of the Vets Driving Vets program consists of?
Yes, through the chair. It's actually a great program. It consists of mostly retired veterans that offer and volunteer their time to drive veterans who are in need of transportation, mostly for doctor's appointments, medical purposes, but just to get to the store. It also it's a great opportunity for vets who are isolated. They tend to reach out to veterans. They relate to each other. We've had a large number of participants. I think we had over 800 participants already this year, and we anticipate that number to grow. Through the chair.
Through the chair, so just for clarification, that's just an expansion of what you're already doing.
Yes.
Okay, thank you. Also on page 352, through the chair, the new benefit payments seem to have decreased significantly from 2016 to 17 and look like you're projecting it to decrease again. Is there an explanation for that?
Madam Chair, I have to go back just a couple years. The former Veteran Service Agency Director, Laura Stradley, came to the county in 2014. At that time, our service officers were only accredited through American Legion, and that did present a problem. My understanding is American Legion only accredits veterans, and we had 1 or 2 service officers on staff who were not veterans and therefore were not accredited. She sought other agencies. I'm drawing a blank on the name, but it's a New York State government veterans agency to accredit non-veterans. She accomplished that. That took a year. So she came to us in 2014. By 2015, we had all our service officers accredited, and they began churning through a whole host of prior applications. That generated a significant payment in 2016, but plowing through what I'll label a backlog, although I don't want to use that word, plowing through that backlog generated payments which aren't going to be duplicated beyond 2016. So this is probably the normal level.
Thank you, great answer. One last question through the chair. On page 561, supplies and materials are decreasing by a very high percentage. It's only $17,000, but it's like 22 to 5. Do we know why that's happening?
I'm sorry, Madam Chair, is that page 561 in general, total supplies and materials? Or a specific line item? I'm sorry, Madam Chair, I was flipping through the book.
I can find it. Just one second, please, Madam Chair, through you. I found it earlier. Since I can't find it now, I'll just withdraw the question. Thank you very much for your answer.
It's okay, Madam Chair. I just would comment that there are a whole host of line items within supplies and materials that were funded directly through the PFC Dwyer grant. We do expect that grant to be renewed in 2018. So this legislature will have the opportunity to amend the 2018 proposed budget.
Are there any other questions? Well, I thank the legislators for being patient, but I'd especially like to thank Mr. Franklin, the administration, and the representatives of the various departments for 2 hours of questions and answers. Thank you. I guess we'll move on to new business. The next item on the agenda is new business. Madam Clerk.
Referral 17-0318.
Moved by Legislator Brown, seconded by Legislator Conley. Is there any discussion? Being none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 17-0319.
Moved by Legislator Conley, seconded by Legislator Draw. Is there any discussion? Being none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 17-0320.
Moved by legislator Draw, seconded by legislator Hebert. Is there any discussion? Being none, all those in favor signify by saying aye. Aye. Any opposed? Item carries. Next item.
Referral 17-0321.
Item is moved by legislator Hebert, seconded by legislator Carbone. Is there any discussion? Yes, legislator Moyle.
I'm sorry, I don't understand. Thank you, Madam Chairwoman. I was just wondering about the rates of tuberculosis in Monroe County. How they, my vague memory of last year is that they had gone up by a significant number. No, they have not. Was that rabies? Excuse me. Through the chair, how are our tuberculosis numbers doing this year? Thank you.
Through the chair, for the last 10 years, we continued to average 20 to 22 active cases per year. That is a case rate of 3 per 100,000 for the entire county. It is a case rate of 10 per 100,000 in the city of Rochester.
Oh. Okay. Thank you very much.
Any other questions? Being none, all those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Next item.
Referral 17-0322. Authorize
Moved by legislator Carbone, seconded by legislator Brown. Is there any discussion? Legislator Conlon.
Chair. Can, through you to the administration, can you tell me, is one of the goals of the Nurse-Family Partnership to increase breastfeeding of new moms?
Through the chair, yes, that is one of the goals.
Thank you, and through the chair to the administration, how are we doing on that benchmark?
Through the chair, our breastfeeding initiation rate hovers between 80 to 85%. The sustainability is a little bit more difficult to achieve. We measure again at 3 months and 6 months, and the rates of mothers continuing breastfeeding drop at 3 months and 6 months. That is our next area that we're going to work on.
Thank you.
Any other discussion?
Through Madam Chair to the administration, you may have answered this. I'm just curious as to, this contract is for 9 months, and I'd like to know, does the county plan to reauthorize this contract and contribute to the necessary funding? Through Madam Chair to the administration.
Through the chair, the reason for the 9-month contract is because this is a grant whose fiscal year is October 1st through September 30th, and it's on a cycle to renew this year, and so our guaranteed funding, the award that we have right now, is through September 30th. We totally expect that we will be refunded, and so we'll be coming back to this fine group to reauthorize and increase later for this year.
Thank you.
Any other questions? All those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Next item.
Referral 17-0323.
Okay. Moved by legislator Brown, seconded by legislator Conley. Any questions? Go ahead, legislator.
Thank you, Madam Chair. Through you to the administration, the last time that the legislature voted on a contract for non-secure detention beds out of county, the number was a bit higher. I think it was either 274,000. And I was wondering, first of all, was the entire amount of that money spent on Ontario County non-secure beds?
Through the chair, no, it wasn't.
Thank you. As a follow-up through the chair, approximately how much was spent?
Through the chair, we'll have to get back to you with that.
Thank you. And one final question through the chair to the administration. What steps is the department taking to decrease the need for out-of-county placement in non-secure detention beds?
Through the chair, I think Monroe County in 2017 took a number of steps to highlight the not always necessary detention of our PINS youth. As a result, we did see a significant decrease in 2017 of PINS youth who were being remanded to non-secure detention. Because of that, North Haven, our local non-secure detention facility, is no longer bursting at the seams. And as a result, we have, with a significant decrease in frequency, used Hopewell. At this point, Hopewell, or the Ontario County facility, is simply being used to enhance the safety of the PINS youth that are remanded, specifically for PINS youth who are a high AWOL risk, who are believed to be victims of sex trafficking, or when there might be a milieu within North Haven that might compromise the safety of a particular youth. We'll utilize the contracted beds at Hopewell.
Thank you. I'm sorry, I have one follow-up after that. Will this contract include a provision that Hopewell will be able to refuse particular children, to house particular children?
Through the chair, Hopewell can refuse particular children, though they can't refuse use of the bed. So if there's a particular child who might prove to not fit into their particular population, they may decline that child, but we could substitute that child with a different child, again, to impact the population.
Thank you.
Legislator Monroe?
I'm Chairwoman, through you to the administration. I think this question was kind of answered in a sideways manner, but this is a high end of the expenditure, and it's on a per diem basis as used. Is that correct, through the chair? It's not a full amount just paid to Ontario County. It's as an as-needed basis.
Through the chair, we reserve 2 beds. If we use beds that are additional to that, that's at a different per diem.
Oh, so this full amount is paid $161,000, whether,
Through the chair, I apologize for my lack of clarity. The reserve beds are paid through that amount.
and we pay for them whether there's actually an individual using that bed or not. Is that correct, through the chair?
Through the chair, yes, it is.
Okay, thank you. Okay, that's different. That's fine.
Any other discussion? Being none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 17-0324.
Moved by Legislator Conley, seconded by Legislator Draw. Any discussion? Yes, Legislator Harris.
Thank you, Madam Chair. I just need a little clarity through Madam Chair to the administration. I was looking through the referral, and I'm just trying to figure out what the mental hygiene, what is the Office of Mental Hygiene, what do they coordinate? Do they coordinate beds, placement for rehab, or just counseling services? Can you clarify a little bit about that?
Through the chair, designated informal statutory authority through law and regulations, mental hygiene law, section 41, establishes the necessity of having a local governmental unit. And under that establishment of authority, it includes a Department of Mental Health or Mental Hygiene. Sadly, our state is still stuck on very antiquated terms, but that's what works, and that's how it's designated. In our county, we do not provide direct clinical care and services such as one would find at an outpatient mental health clinic. However, we do coordinate services for high-priority populations, high-risk populations, ensuring that individuals who need special consideration for care management, housing, and oversight by the court at times for ensuring adherence to treatment, that those services are in place and provided effectively in the community.
Thank you for clarifying. I just want to be clear with my understanding through Madam Chair to the administration. There is no support for anyone with substance abuse, opiate, or any other type when it comes to facilitating placement for rehabilitation services, inpatient specifically.
Through the chair, actually it's a several-part answer to the question. I neglected to mention that under mental hygiene law, we actually oversee 3 distinct areas of disability. One is mental health, one is substance abuse, and the last is developmental disability. We do not coordinate directly paying for treatment services for individuals, including those who might need inpatient rehab. However, there are state OASIS. OASIS stands for Office of Alcoholism and Substance Abuse Services, provides funding which then is contracted for with providers who do provide some of those services. The majority of those services are coordinated through community entities and paid for through individuals' insurance coverage rather than paid for through our office.
Thank you for clarifying that. And this may be a little bit of ignorance on my part through Madam Chair to the administration. I'm just curious as what the $41 million is covering. What type of services are we covering if we don't really offer any services?
So these are in contracts with provider agencies, and there are more specifics, I'm sure, contained within your packets, but that are split out across the 3 disability areas. So they are paid to providers to conduct the services to treat and provide care coordination for individuals in the community across these 3 disability areas. So they aren't used by our office specifically to treat or pay for treatment for individuals. They would sponsor the 40-plus organizational entities that already provide these services in the community.
Thank you. That definitely clarifies that for me. I really appreciate your in-depth explanation. Is there any, do they give you any data as a result of last year's numbers as to the results of what's the word I'm looking for? I'm having a brain fart. Some trends on the results of the money that we spend.
Through the chair, I believe what you're referring to is services utilization. Yes, that is available through a couple of means. One is we are one of the only counties in the state that maintains our own behavioral health community database, to which our mental health service providers report on service utilization levels. On the New York State OASIS side, they have a very detailed reporting process for their certified providers to which they must report data specific to the identified client upon intake as well as completion of treatment. So we are able to pull that data from there. There are a multitude of reports available online, but also we can access those as needed for various purposes to demonstrate utilization levels, where the recipients of services live, and whether the level of use is going up or down, et cetera.
Oh, that's great. To the administration, through Madam Chair, I'm just curious to know, does those utilization levels have any direct numbers related to beds for rehab, for inpatient services? Do you guys track any of that? Even though the county doesn't provide it, but those agencies do. I'd be interested in looking at those numbers, actually a summary of all the numbers for utilization for 2017, if you can provide that for me. Thank you.
Through the chair, we certainly have information that describes the bed capacity by type of service, and we work very closely in our administration to monitor that. As far as the total amounts used, did you, through the chair, to clarify, did you ask for numbers for 2017? Because 2017 would not be complete, but we could provide it for 2016, as well as whatever's available year-to-date in 17.
Well, can you do 2016 to year-to-date 2017 through the chair to the administration?
Through the chair, yes, we can pursue that and supply everything that's available.
Thank you. Just for clarity, would you be able to, oh, never mind, I'm all set. Then thank you so much for your answers.
Thank you.
Any other discussion? All those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 17-0325.
Moved by legislator Draw, seconded by legislator Hebert. Is there any discussion on this? All those in favor, please signify by saying aye. Any opposed? That item carries. Next item.
Referral 17-0326.
Item is moved by legislator Hebert, seconded by Vice President Carbone. Is there any discussion? Being none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 17-0327.
Moved by Vice President Carbone, seconded by legislator Brown. Is there any discussion? Being none, all those in favor signify by saying aye. Any opposed? Item carries. Next item, Madam Clerk.
Referral 17-0328.
Moved by legislator Brown, seconded by legislator Connolly. Is there any discussion? Being none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 17-0329.
Moved by legislator Connolly, seconded by legislator Draw. Is there any discussion? Being none, all those in favor, please signify by saying aye. Any opposed? Item carries. Madam Clerk, last item tonight.
Referral 17-0344.
Moved by legislator Draw, seconded by legislator Hebert. Is there any discussion? Being none, all those in favor, please signify by saying aye. Any opposed? Item carries. Are there any other matters to come before this committee? There being no other matters, the November 28th, 2017 meeting of the Human Services Committee stands adjourned. The next meeting of the Human Services Committee will be held on Tuesday, December 19th, 2017 at 5:30. Thank you, everyone.